Hello and welcome to sqadia.com. I'm Dr. Mahnoor Ehsan and today we are going to discuss Loop Diuretics. This is the second video of the diuretic series. In the previous video, we have seen the detail of thiazide group and now we will discuss Loop Diuretics in detail. So, first of all, let us see what are the included drugs. This group includes 4 drugs which are furosemide, bumetanide, torsemide and ethacrenic acid. Structurally, furosemide, bumetanide and torsemide are sulfonamide derivatives, whereas ethacrenic acid is phenoxyacetic acid derivative. So, although ethacrenic acid is structurally different from rest of the 3, but it has the same site of action and the similar mechanism of action, therefore it is placed in the same group. Now, loop diuretics are known as most efficacious of all the diuretics. Why they are called so, we will discuss when we will see the mechanism of action. Now some important points regarding the loop diuretics. We have seen that thiazide diuretics were known as ceiling diuretics because increasing dose above normal was not increasing their diuretic response. These loop diuretics are a step ahead and they are known as high ceiling diuretics. So this is important to remember. Next comes their site of action. As the name indicates, they are acting on the loop of Henle, but more precisely, they will act on the ascending limb of loop of Henle. Next comes the duration of action, and this is again important because it is relatively shorter compared to thiazide group and it ranges from 2 to 4 hours. So they will have a rapid onset but they will have a briefer duration of action. So this makes their use in emergency medicine when they will have rapid onset of action but they will act shortly. Next comes the route. The thiazides were available by the oral route, whereas loop diuretics are available in both oral as well as parenteral route. Next, see the excretion. Now their excretion is also via the same route, that is through urine in the kidneys. Now there are certain important points that we should remember regarding the individual drugs. Whenever we are discussing loop diuretics, we should keep following points in mind. Regarding furosemide, we should know that it is the prototype and it is most commonly used of all the diuretics. Next comes bumetanide. Bumetanide is much more potent than furosemide and therefore its use is increasing. Regarding torsemide, we should know that this is not of great importance and it is limited use and it is used for management of hypertension. Lastly, ethacrenic acid, you should remember that it is uricosuric. Now, why it is called uricosuric? Because it will cause uric acid secretion in the urine. So, among all these, ethacrenic acid is having a unique property that it is a uricosuric drug. But unfortunately, it has a lot of side effects. Therefore, its use is limited. So, these were some important points regarding individual drugs that we should always keep in mind. Now comes the mechanism of action, which is very important. So here you can see this is a tubular cell. On one side there is tubular fluid, on the other side there is blood. Then on the luminal membrane there is sodium potassium chloride cotransport, and this will cause the reabsorption of sodium, potassium and chloride into the cell. Then we will see that on the basal side there is sodium potassium ATPase, and similarly on the same side there is an other transporter which will transport potassium and chloride into the cell. Then on the apical side you can see there is a potassium selective channel. Now what happens that this part of the nephron is known as diluting segment of nephron because its cells are impermeable to water. They will not allow water to enter, whereas solutes which are sodium, potassium and chloride, they are maximally absorbed at this site. 25 to 35% of the salt reabsorption occurs in this part of the nephron. Therefore, the drugs which target this part will be the most efficacious of all the diuretics. So that's why the loop diuretics are most efficacious, because they will target the major site of solute reabsorption in the cells of the kidneys. Now what happens normally that you can see potassium is being pumped into the cell from both the sides, and this will cause a high intracellular potassium concentration. This will cause potassium to escape out into the lumen through a potassium selective channel on the apical side. But you can see that potassium is going alone. It is not accompanied by any anion. So this will set a positive potential in the lumen, and that will cause the reabsorption of calcium and magnesium. So not only sodium, potassium and chloride, they are being absorbed here, but also this is the major site for calcium and magnesium reabsorption. So you should keep in mind that loop diuretics will affect calcium and magnesium also. Now what is the target of loop diuretics? It is this sodium potassium 2-chloride co-transporter on the luminal membrane. So this was the whole mechanism of action. So after seeing the mechanism of action, now we will see what will be the effects on the ion concentration as well as urine volume. So this is very easy to remember that all these ions will be excreted in the urine in greater amounts. So what the loop diuretics will do, sodium, chloride, potassium, hydrogen, calcium, magnesium, they all will be excreted in urine in greater amounts, and so will be the urine volume. That these drugs are not only going to raise the concentration of these ions in the urine, but they are also going to produce copious amounts of urine. So urine volume is also going to be raised. So they are going to produce massive diuresis, and they are very effective as well. After the effects, we will see the therapeutic uses of loop diuretics. And regarding this, we should remember that they are the drug of choice for the edematous states. What edematous states? Now, whenever there is excess fluid accumulation in the body, whenever there is edema, whether due to heart failure or in liver failure as in case of ascites, or acute pulmonary edema, these diuretics will be the drug of choice, because they will have a rapid onset of action and they will produce massive, severe and rapid diuresis, and this will help a lot in managing such patients. And that is important that these diuretics are used in emergency medicine. So you should remember this very well, that they are the drug of choice for the edematous conditions because of their rapid onset and their brief duration of action. They will help alleviate the symptoms of such patients. Next comes severe hypertension. We have seen that thiazides were the drug of choice for hypertension. Now loop diuretics, as we have seen that they have a very briefer duration of action, just 2 to 4 hours. So this is a very disadvantage. That's why they are not preferred regarding hypertension. But whenever response to thiazides is inadequate, you can add loop diuretics to achieve better control of blood pressure. Next comes severe hypercalcemia. As we have seen that unlike thiazides, loop diuretics are promoting calcium excretion in urine, so this makes them important to be used in the management of severe hypercalcemia, where they will promote the urinary calcium excretion. But whenever we are using them for this purpose, we have to be cautious. We have to maintain and monitor the fluid levels, because whenever we are going to give loop diuretics, they are going to produce massive diuresis. So we have to give fluid replacement as well. We have to give IV normal saline as well. Otherwise, they will be of no use. Rather, they will further aggravate the condition and they will not reduce the calcium concentration. So whenever we are going to use loop diuretics for hypercalcemia management, we have to monitor the fluid levels and we have to give IV fluid to the patient to maintain the fluid and electrolyte balance as well. Next comes hyperkalemia. As we have seen that they are promoting potassium excretion in the urine, so this makes them important for use in management of hyperkalemia as well. Next comes the adverse effects. Now, the first and most important adverse effect is metabolic hypokalemic alkalosis. Now, it seems quite lengthy and difficult, but if we recall the effects, then this will be very easy to remember. Because alkalosis means the pH is going to rise. Why? Because they are causing hydrogen ion secretion in the urine. Hypokalemic, because they are causing potassium wasting. So metabolic hypokalemic alkalosis is an important adverse effect. For this purpose, we have to monitor potassium levels and we can give potassium supplementation in diet, or we can switch to potassium sparing diuretics if the adverse effect is very severe. Next comes hypovolemia, as they are going to promote excessive fluid loss from the body. So this will cause rapid sudden reduction in the blood volume, and if fluid is not maintained, that can lead to hypotension, shock and even arrhythmias. So hypovolemia is also an important adverse effect. So they should be used very cautiously. Next comes ototoxicity. Now this property is most important when we are talking about ethacrenic acid. Ethacrenic acid is most ototoxic among all the loop diuretics, and when they are ototoxic, particularly when they are used in combination with the aminoglycoside antibiotics. So continued use and use in conjunction with the aminoglycoside antibiotics will cause ototoxicity. It will cause permanent hearing loss and even it can affect the vestibular function. Next comes the hypomagnesemia, because they are promoting magnesium excretion in the urine. So hypomagnesemia can occur particularly by chronic use in elderly people. So we can have to monitor the magnesium and we have to give magnesium in diet to such patients. Next comes hyperuricemia, and the most notorious for these are furosemide and ethacrenic acid, because they will compete with uric acid for secretion and they will cause uric acid deposition in the body. It will deposit in the joints, it will cause gouty attacks and it can precipitate the attacks if the patient is already having gout. So this is also an important adverse effect of the loop diuretics. Next comes hypersensitivity. So some patients might be allergic to these group of sulfonamide drugs, but that is very rare. This was all about the loop diuretics and their uses, their adverse effects, all the detail. Hope you find this video useful. Thanks for watching.